Here's something that might surprise you. 70% of Americans retire before they're eligible for Medicare at age 65. Think about that. 7 out of 10 people. That means if you're planning to retire early, or if life forces you to retire early through a layoff, health issues, or family obligations, it's very likely the Medicare gap problem will affect you. And yet, most retirement planning completely ignores the health insurance gap between retirement and Medicare. They just assume you'll work until you're 65. But the reality is that most people don't make it that long. So today, I'm breaking down every option you have for health insurance before you're eligible for Medicare. What they cost, what they cover, and which ones actually make sense. Because 70% of us are going to need this information, let's make sure you are prepared. If you retire or get laid off at 58 or before, and 56% of workers do get laid off before they're ready, that's 7 years without employer-sponsored health insurance. And during those 7 years, you're at an age when health issues are more likely to pop up. You need good coverage. You can't afford to go without it. So I want you to know that you have options, real options. In fact, there are 5 main options you can consider. Some are expensive, some are affordable, and some you probably don't even know exist. The reality is that health insurance before Medicare is going to be one of your biggest retirement expenses. For some people, it's more expensive than their mortgage. Ignoring it or hoping for the best is not a plan. That's a gamble with both your financial security and your health. So let's talk about what your actual options are, what the benefits and disadvantages of each option are, and at the end, I'll break down the costs of each so you can compare. Here are your 5 main options. Option 1, the Affordable Care Act, or ACA marketplace. This is probably going to be your best option if you're retiring early. The ACA, also known as Obamacare, offers comprehensive health insurance plans through healthcare.gov or your state's marketplace. Here's what you need to know about the Affordable Care Act. First, these plans cover essential health care benefits, doctor visits, hospital stays, prescriptions, preventive care, and they cannot deny you coverage for pre-existing conditions. That's a huge benefit. Second, you qualify for a special enrollment period when you lose your job-based coverage. You don't have to wait for the annual open enrollment period. You have a 120-day window around your job loss date to enroll. Third, and this is very important, you may qualify for premium tax credits based on your income. If you're living on savings or retirement account withdrawals and your income is relatively low, you could get significant help paying your premiums. The catch? Your income matters a lot. If you're withdrawing large amounts from retirement accounts, that counts as income and could reduce or eliminate your subsidies. So this is where strategic planning comes in. My advice is to work with a financial advisor to figure out how to manage your withdrawals to keep your income in the sweet spot for subsidies. My take, for most early retirees, the ACA marketplace is going to be your go-to option. It's comprehensive, it's protected by law, and it can be surprisingly affordable if you manage your income correctly. Option number 2, COBRA. COBRA allows you to keep your employer's health insurance for up to 18 months after you leave your job, sometimes longer, depending on your situation. The pros to COBRA: you get to keep the exact same coverage you had while working. Same doctors, same network, same prescription coverage. No disruption. The cons: COBRA is expensive, really expensive. When you were working, your employer was probably paying 70 to 80% of your premium. Under COBRA, you pay 100% of the premium plus a small administration fee, usually around 2%. For a lot of people, that's going to mean going from paying $200 to $300 a month to suddenly paying $800 to $1,200 a month or more for family coverage. When COBRA makes sense, is if you have ongoing medical treatment and switching plans would disrupt your care. COBRA might be worth it for a few months while you transition to an ACA plan. If you're late in the year and already have met your deductible, it might make sense to stay on COBRA through the end of the year. But for most people, COBRA is a short-term bridge, not a long-term solution. My take? Use COBRA strategically if you need it, but don't plan on staying on it for the full 18 months unless money is absolutely no object. Option number 3, your spouse's employer plan. If your spouse is still working and has employer-sponsored health insurance, this could be your easiest and most affordable option. Most employer plans allow you to add a spouse, and the employer usually subsidizes a portion of the premium, even for dependents. The catch is you can usually only join your spouse's plan during their company's open enrollment period, unless losing your own coverage qualifies as a life event that triggers a special enrollment period. Check with your spouse's HR department. My take? If this option is available to you, it's probably your best deal. Employer-sponsored insurance is almost always better and cheaper than buying individual coverage. Option number 4, retiree health benefits. Some employers, though they're increasingly rare, offer health insurance to early retirees as a part of their benefits package. This is more common in unionized jobs, government positions, and some large corporations. What to do? Check with your HR department before you retire. Ask specifically, do you offer retiree health benefits? What does it cover? How much does it cost? How long can I stay on it? My take, if your employer offers this, fantastic. Take it, but don't count on it. Most employers have phased these benefits out over the last 20 years. Option number 5, Medicaid. If you meet low-income requirements and live in a state that expanded Medicaid under the ACA, you may qualify for free or low-cost coverage through Medicaid. Who qualifies? Well, this depends on your state and your income. In expansion states, individuals earning up to 138% of the federal poverty level may qualify. For 2024, that's roughly $20,000 for an individual or $27,000 for a couple. My take, if your retirement income is low enough to qualify, Medicaid can be excellent coverage with minimal or no cost. But most early retirees won't qualify unless they're very strategic about managing their income. Here are the important things you need to know about the healthcare gap. Start planning early. Don't wait until your last day of work to figure this out. Start researching your options at least 6 months before you retire. You do not want a gap in coverage, not even for a week. One unexpected medical emergency without insurance could wipe out years of retirement savings. Health savings accounts, HSAs, are your friend. If you have an HSA, those funds can be used tax-free to pay for health insurance premiums while you're unemployed, including COBRA and ACA market premiums. This is one of the most underutilized strategies for early retirees. If you're still working and have access to an HSA, max it out every year. That money will be incredibly valuable during this gap period. Avoid short-term health plans. You'll see ads for cheap short-term health plans. They sound tempting because the premiums are low. Don't do it. These plans can deny coverage for pre-existing conditions. They have very low benefit caps and often don't cover essential services like prescription drugs or maternity care. They're designed for young, healthy people who need temporary coverage while they're between jobs, not for retirees with decades of medical history. My take, short-term plans are not worth the risk. Stick with comprehensive coverage. Enroll in Medicare on time. This is very important. When you turn 65, you need to enroll in Medicare during your initial enrollment period. That's the 7-month window that starts 3 months before your 65th birthday and ends 3 months after. If you miss that window, you could face late enrollment penalties that last for the rest of your life. This is very important. Mark your calendar. Set reminders. Do not miss this deadline. Let's talk now about costs. I'm sure you're wondering what each of these options actually costs. Now, I'm not going to sugarcoat it. Health insurance before Medicare is expensive. If you're buying an ACA marketplace plan without subsidies, you could be looking at $600 to $1,200 a month for an individual, or $1,500 to $2,500 a month for a family. With subsidies, that could drop to $200 to $400 a month, or even less, depending on your income. COBRA could be $800 to $1,500 a month or more. Your spouse's employer plan might be $300 to $600 a month. The bottom line, budget for it. This is not optional. This is a real cost that you need to account for in your retirement planning. I just want you to know that you have options. Look, I know health insurance is confusing and expensive and frustrating, but you do have options. And for most early retirees, the ACA or Obamacare with income-based subsidies is going to be your best bet. It's comprehensive, it's protected by law, and it can be surprisingly affordable if you plan strategically. But don't wait until the last minute. Start researching now. Talk to a financial advisor. Run the numbers, because retiring early is absolutely possible, but only if you have a real plan for health insurance. If this video was helpful, it would mean a lot if you would tap that like button so YouTube will send this video out to more people. And drop a comment and let me know what's your biggest concern about health insurance before Medicare. And if you're planning for early retirement, I'm breaking down every piece of the puzzle, from YouTube income strategies to budgeting for living your best life in retirement. Thanks for being here. Now go out and figure out your health insurance plan so you can retire early. See you in the next one.